You. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. Tonight, we're going to start out the first 30 minutes, talk a little bit about vascular surgery with a vascular surgeon on staff right here in Boca Raton at West Boca Medical Center, great hospital at Palmetto Park Road in 441, a little west of the studio here. And then the second half of the program, we're going to talk with a podiatrist from Wellington Regional Medical Center. So we're covering a lot of Western Palm Beach County tonight, and we're going to talk about a lot of topics. I want to give an intro to our guest. He's going to be coming back to the show. I actually had him on my show about a year ago, so this is very timely. It's Dr. Moji Gashti. He's a vascular surgeon. And Dr. Gashti, welcome back to the program. How are you doing tonight?
I'm fine. Thanks for having me again.
And thanks for coming on this adventure of health. Like I was saying before, I just try to bring the latest in health to South Florida and beyond. That's why I start out that way. We actually have some listeners recently in London because it's on Facebook Live now, so you can catch it anywhere. And if you're ever looking for this show or other shows, check out allcountyhealthcare.com. We'll put all the radio shows there, our sponsor, and then also the Facebook Live feed, All County Healthcare INC, where you can watch us every Tuesday, 6 to 7, and every Friday, 5:36. So, Dr. Gashti, I wanted to have you back on the program, and I just want to start by thanking you for your service. I realized you were on a medical mission when I reached out to you. Let's start there. Were you recently, was it in Haiti?
Yes, actually, I got your email while I was in the operating room in Haiti. Yeah, it's a volunteer program. We've been doing this since 1995. Actually, we go once a year to Cap Haitian. That's the second largest city in Haiti, and then from there we drive about 12 miles to a small hospital in a city called Milo, and that's where we've been going once a year to offer our services free of charge. We're all volunteers.
That's great.
It's been great.
I can see it in your eyes just talking to you how passionate you are about it. And I first learned about this when you came to South Florida. I did a little Google search on you, and I believe it was the Baltimore Sun had done an article that was pretty big that went national, and I read about you there because I know you did. You worked in Baltimore as well, but. Thank you for what you do outside of medicine. I mean, that's great. There are neighbors right here in the Caribbean. And sometimes living the way we do here in the U.S., we may forget about, others.
Yeah, it's amazing how an hour and a half away from our borders, country can be so poor and can lack any kind of medical services. And it's just, it's very gratifying to go and help people who are also very grateful for what we do for them. It's a group of doctors and nurses, and I bring a couple of residents with me when we go. It's a huge, huge experience for them. Not just the medical aspect of it, but the human aspect of it. And I'm hoping that they grow up to follow and keep doing this sort of thing.
Yeah, and these are obviously a population that maybe doesn't have access to the type of healthcare we have here in the U.S.
Oh, absolutely. I mean, there is no, as an example, there is no CAT scanner. There is obviously no MRIs. I mean, we'll be lucky if we have an ultrasound before we operate on somebody.
Oh, wow.
Yeah, it's very primitive, what they have there. So if it wasn't for all the volunteers who go there, and there are many groups that go to this hospital, both from the U.S. and Canada, and if it wasn't for the volunteers, the hospital wouldn't be a hospital. But because of all these volunteers, it's actually turned out to be a big medical center now. When we first started going, it only had 21 beds. It's up to 120 beds now. New ORs. I mean, it's become a decent hospital over there with all the limitations that they have. You know?
And I was so excited this morning to have you back on the show. The first thing I did was search for some images, and I found some images. You're doing full-on surgery there for a whole bunch of different kinds of ailments. Like, this is not just a visit to the doctor. I mean, you're there doing surgery.
Well, because they, the patients, they kind of wait for us to get there. So for a whole year, all the surgeries are sort of...
They line them up?
They line them up. I mean, this week we did 44 surgeries in 5 days. And these are not lumps and bumps. I mean, these are huge goiters, huge mastectomies for breast cancer and hernias and laparotomies. Big surgeries. So they line them up. They wait for us to come. There's only one other general surgery team that goes. So they're kind of limited. So yeah, the surgeries are not little lumps and bumps.
No, I could tell in the pictures. Well, kudos to you and your staff there that go along with you. We'll keep us up to date on that as long as we're doing this radio show. And if we can ever help you out, get the word out, anything you need, let us know.
That's great.
We're starting to get a lot of listeners and viewers. So I wanted to have you on. Obviously, vascular surgery, when I was a reporter a few years ago, not something I really looked into very often. But as I got into the healthcare sector, I've learned so much, and the reason why is because one of the main things is with diabetes and some of the ailments. But one of the questions I wanted to ask you, this isn't something like I wake up in the morning, I call my vascular surgeon. This is still a medical specialty that an individual would be referred to, like maybe a primary care sees something and then you're referred to, or is it getting different where people just come to the office and say, hey, I want my vascular system checked out?
Yeah, for the most part, you're correct. Is a referral pattern that is established between us and referring physicians. But it also depends on the territory of vascular disease that you're concerned with. The only part of vascular care that patients sort of self-refer are with veins, varicose veins, spider veins, and things like that. But other than that, for arterial disease, whether it's an aneurysm or whether it's a carotid artery, whether it's arteries in your legs, those are usually areas where the primary care doctors sort of figure out that there must be something going on here, and therefore they refer them to a vascular specialist.
And your 2 offices in South Florida still, correct?
Yes, we have one in Deerfield.
Okay.
On Hillsborough, and the other one is at West Boca Medical Center on the campus there.
That's right, and I'll give out the information there in a bit as we get further into the interview. And you're on staff at West Boca Medical Center?
Correct. And then several of the Broward Health.
Okay.
The one on Sample Road, which is Broward North, Broward General, and also Coral Spring.
Okay, nice. Now, another question I wanted to ask you is, this is another topic I didn't know until a few years ago, peripheral arterial disease, and the acronym PAD, which I'm a little more familiar with. I see it kind of around. What is it, and why would I have to see, or anyone have to see a vascular surgeon for it?
Well, yeah, PAD or PVD or peripheral arterial occlusive disease. When we talk about that, we're talking about lower extremities. That's one of the more common conditions that a vascular surgeon actually deals with. So when you have blockages in your arteries of your legs, what happens is that your legs would hurt when you walk. And that's why patients come to see us, because they walk from their home to Joe's home 2 blocks down the road, half a block down the road. their calves or their thighs or their buttock, depending on where the blockage is in the artery, it hurts. People describe it as Charlie horses or cramps, and they have to stop. You stop walking for a minute or so, the pain goes away. You walk again, you get the pain again. So that's called claudication. That's because of lack of blood flow to that muscle. It's just like your heart. If you have a blockage in your heart artery and you go out there and start running around, you get chest pain. It's the same scenario because heart is a muscle as well. And if you don't give it enough blood, it starts hurting. That's how it lets you know, hey, there is something going on here. So not all leg pain is from arthritis. So if your calf hurts when you walk, if your buttock hurts when you walk, that's peripheral vascular disease until proven otherwise.
Okay, and we're here with Dr. Seyed-Mojtaba Gashti, but I'm going to abbreviate it because you allow me, Dr. Moji Gashti, here at Vascular Surgeon, right here in Boca Raton at West Boca Medical Center and other hospitals in the area. Now, can vascular surgery be done in a minimally invasive manner? The reason I ask, it kind of sounds like vascular surgery. Oh my, it sounds like, I know it was something that used to be done mostly open, but I believe and correct me if I'm wrong, there are some newer minimally invasive techniques.
Oh, absolutely. There is still places and conditions where you do have to do open surgery. But nowadays, for the most part, the technology that has been developed in caring for vascular patients is just amazing. As an example, I'm going to give my age away, but when I was in training and we did an abdominal aneurysm, a patient would stay in the hospital for 7-8 days in the ICU, and then a couple of weeks on the floors before they go to rehab and all of that. Today, we do the same thing, and patients go home the next day. And the incision is about an inch incision in the groin. There is no abdominal incision or anything like that. So minimally invasive vascular surgery, also known as endovascular surgery, has really revolutionized the way we take care of vascular patients. It is just amazing.
Okay, and that's something that you gave the example of abdominal aneurysm. Now that's something that if it wasn't treated could result in a big problem, maybe even in death.
Yeah, so an aneurysm is when an artery, any artery, actually balloons out, just like a balloon. And the bigger a balloon gets, the higher the risk that it breaks and it ruptures. So the same thing can happen to an aneurysm. Now, it can be in your chest, it can be in your abdomen, it can be in the arteries of your legs, but the most common areas that we deal with are the chest and the abdomen. So the thoracic aneurysm or abdominal aneurysm. And as an example, with an abdominal aneurysm, once it ruptures, about 80% of people expire. They don't make it. So it's something that as physicians we need to be aware of, and we need to look for them if you have the certain risk factors for it, and it needs to be taken care of.
That's why we need to be going to the doctors a couple times a year now, preventative care. So if you or your team sees something, they can treat it in an early fashion. A lot easier on you, a lot easier on the body as well. I actually, a quick story. I actually had a man in this studio right here, and we talked. He was 53 years old, and he was in media, and he had an abdominal aortic aneurysm. And long story short, one night after work, his wife fixed him dinner. They sat down, watched TV on the couch, and he had this horrible pain in his back. And before you know it, luckily he was rushed to a hospital, and it was quite a surgery, he said, but he's so happy he got to see his granddaughters. So definitely go see our great doctors in South Florida here if that ever is something that happens to you. I got about 30 seconds, so I'm just going to probably save until our first commercial break, save the next question until we come back. But I'll give you a little tease. It's going to be, I'm going to ask a little bit about minimally invasive vascular surgery, if it's catheter-based, because we kind of discussed that vascular surgery started out open. And we're going to talk about the latest and greatest in vascular surgery on the You and Your Doctor show. Living a long...
All county County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Dr. Moji Gashti of West Boca Medical Center, and also promised I give out his two locations, 9980 Central Park Boulevard, Suite 314. So that's right in front of West Boca Medical Center in the 9980 building. And then also in Deerfield Beach, 3467 West Hillsborough Boulevard, Suite B. Phone number is 561-483-3989. And I'll give that out again, everyone, as well. Or you can check out West Boca Medical Center site. I know there's a nice write-up on you. Actually, it was nice this morning. I went on that website and I saw you could read about all the vascular surgeons and all the different specialties on the actual website, West Boca Med Center, CTR.com, and you can take a look. But before the break, I was asking, is this minimally invasive surgery that you're able to do without a scalpel, is it catheter-based? It goes through, I guess, would it be the groin, or is there another vein or artery that you would use?
No, the majority of cases are done through what's called the femoral artery, and that will be in the groin, just because it's easily accessible, is a large artery, and afterwards is a place where we can sort of achieve hemostasis. But yeah, I mean, it's all catheter-based. What that means is that we are really working remotely. For example, if I am, angioplasting or stenting a carotid artery, a blockage in the carotid artery, we have to navigate our way from the groin all the way up through the aorta and get up to the carotid artery. So we do this under X-ray, live X-ray, or what's called fluoroscopy. So it's all done. Initially is what's called a guide wire. So as the name implies, is what guides us to where we're going. So once the wire is where we want it, then the catheters and the balloons and the stents, everything else follows the wire. So again, that's why it's called a guide wire. But all of it is catheter based and wires. And
when did it? You've seen it kind of at all. When did it change over, kind of from open? I'm sure you had to do the education and training. Then all of a sudden, you're doing mostly catheter based treatments.
Well, I mean, it was a gradual process. Again, I did my vascular fellowship training in 1998. And at that time, only major medical centers, a few people were doing this sort of endovascular catheter-based surgeries. But every year, more and more people started doing it, and the fellowship program, started teaching them to their fellows. So that's why then I took a year off after practicing for 6 years and just went did another fellowship just to learn the endovascular part of this. Because, again, at the time I did my original fellowship, it was all open.
You didn't anticipate that, huh?
That's right. Which is great because nowadays the recent trainees that come out of their fellowship, they really don't get to do a whole lot of open surgery. So that's something that lacks in our training programs and the ACS and the people who are in charge of this trying to address all of that. But I kind of feel privileged that I did a whole lot of open surgery and then was able to do endovascular surgery for a whole year.
Yeah, you're kind of like in the perfect time to be a vascular surgeon. That your age that you were able to start open and then transition over, it's kind of like, it seems like it's just perfect because you understand it like obviously no one else.
Yeah, I love working with students, medical students and residents, and they always ask me, why should I go into vascular surgery? And I just tell them there's no other specialty at this time. Well, I'm a little bit biased for for vascular, but truly, I mean, the technological advances and everything that we're able to do with little tiny incisions, it just makes this field so incredible.
And I know there's a lot of robotic surgery going on because we're always talking to doctors on this show about it, and I know it's in vascular as well. But you mentioned teaching now. Tell us where you're teaching today.
Well, right now, West Boca Medical Center.
Okay, so those are residents in the program.
Right. As of July, we're going to have residents from FAU to come down and be part of the surgical services. So they're going to scrub with general surgeons, vascular surgeons. So we're going to have residents again. We had a big residency program in Baltimore where I came from, and I kind of miss it for the last year and a half. So I'm looking forward to July when we get residents.
Nice. That's great news. And FAU's medical program and medical school has really grown exponentially in the last few years. And kudos to what's going on over there in the Boca Raton community, South Florida community as well.
Absolutely, yeah.
That's great. I didn't know that. We learned something. That's great. Well, we're learning things left and right, but I didn't know that. And, I'm a newspaper reporter on the side, so I'm jotting down little notes here and there to pitch to my editor.
Right.
Well, kudos again because the mission and you're so passionate about teaching students, and, it doesn't get any better than that to actually, give the knowledge to the next generation.
Oh, absolutely. And I look back at people who trained me. And I was, again, privileged and very lucky to have very good professors and trainers. And I just want to give something back. I mean, when I get old and I have an aneurysm, I need someone to take care of me. So so we need to train new physicians and make sure that they become competent surgeons.
And minimally invasively sounds better as well. Who knows? Maybe someone after an aneurysm one day will walk right out of the hospital. It could get to that point. I mean, eventually, if it keeps moving like this.
Oh, I mean, even nowadays there are patients who can be discharged, but we just keep them overnight just to keep an eye on them.
Definitely. That's a good idea there. Now, we talked a little bit about, one of my questions I had jotted down was about open approaches. Now, I always thought that the carotid artery, that's the one in the neck, folks, would have to be done open because it's so far away. But you're able now to go through the groin and get all the way up there into the carotid without...
Oh, absolutely. I mean, actually, when I was in Baltimore, I was one of the PIs, the principal investigators of a couple of devices for carotid stenting. And we just go through the groin, again, navigate our way up there. We have devices that are called filters that would place into the artery beyond where the blockage is so that none of that plaque breaks off and goes upstream to the brain, because then you can cause a stroke. So that's how we prevent strokes during stenting. So, no, again, we go back to when we were talking about the technology. It's just amazing what we can do and where we can get to through the groin, all the way down to the toes, all the way up to the head, and just do what we need to do.
Do you still have a scalpel in the surgery room just in case? Like, or is if you totally put that in your black bag and locked it away? Or
Well, I mean, it's not all rosy picture here. I mean, complications can occur.
Or you may have to go open for
absolutely.
a bit?
If you're angioplasting an artery, that's when we put a balloon in and open a blockage. Well, if you don't size the balloon the right way, if the artery is too calcified, you can rupture that artery. And, you can put stents to correct that, but sometimes you have to actually be ready to open and take care of the injured vessel.
But just having the knowledge of doing that before, I mean, you definitely have, what's the word, not only the experience, but the know-how, and then also the confidence. That's what I was getting to. It was right on the tip of my tongue. So that's when open vascular surgery may still be needed. You mentioned a balloon. Are there, I read about this the other day, and it kind of blew my mind. Drug-coated balloons. So they actually put the helping agent on the actual balloon. So when it's in the artery, it's already helping the person to heal in a way?
Yeah, so what happens after an angioplasty is that we essentially are injuring the inner lining of the artery to open it. We're cracking open the plaque that is built up in the artery. So the arteries re-narrow because of scar tissue after a while. So the idea behind drug-coated balloons is that we deposit this medicine, is usually what's called paclitaxel. We deposit it in that area, in the arterial wall, so that it reduces the amount of scar tissue that's going to form. So it prevents the artery from narrowing again. Again, technology is drug-coated balloon, drug-coated stents. There are stents that are eluted with drug, so that, again, the re-narrowing of the artery is slowed down. There are stents that now actually are absorbed by the body. So they stay there for a few weeks. They do what they're supposed to do, and then they just are absorbed and go away. So they don't cause that continuous scar tissue formation. So the technology is just amazing.
Yeah, I read about that too. I don't know if you can see, people listening on the radio probably can't see my passion for reading about vascular surgery, but I really do. And absorbable stents, I was just going to ask you about, and you went right into it. It's this field has really come a long way in surgery as a whole. And I'm always asking doctors too about robotic surgery. And you mentioned a little bit, but it's fascinating when I ask a general surgeon or someone who used to do a lot of laparoscopic surgery, and they say, you know what, David, it's a lot better for me on my arms and my body and whatnot. And I never thought about that.
Yeah.
Like, we never think about the stamina of the physicians. I mean, sometimes maybe you've been in 10, 12-hour surgeries. I'm sure you have. And
oh, yes.
over a week period, that could really take its toll on you. And as with the guided, like you said, the wire guided, and when everything, goes right, everything's a little easier on the body as a surgeon?
Oh, yeah. I mean, that's why most surgeons have back problems, because we really, with this endovascular surgery, again, as I said, you're doing it under live X-ray, fluoroscopy. So you have to wear lead aprons, and these are heavy.
Oh, yeah.
And if you're doing a couple-hour case, that can take a toll on you as far as your back is concerned, your eyes. Is X-ray exposure, so you got to protect yourself as well as the patient, because you don't want to have a patient under X-ray for 3 hours because they're going to have radiation injury. So you just got to know what you're doing and do it right and do it safely.
And your staff as well, they have to wear that as well. And the listeners and viewers know I've attended 6 surgeries, a few as a reporter and then a few in the healthcare PR world. And I had to wear those, and it was heavy after. I think the longest one I attended was like an hour and a half, because the surgeons are doing great jobs and the surgery time is cutting down. But still, I remember now how heavy it was, and we never think of the doctor or the staff. And you're doing that, how many hours a week? And just 4 days, 5 days, maybe more. Now, I people have asked me too, is there a day that you do more surgery than others? I kind of have a theory. I always wanted to ask a surgeon, do surgeons do a lot of surgery on Tuesdays and Thursdays if they're able to plan it? Because the Friday is maybe when the new line of patients maybe come and go in for tests over the weekend, and that kind of brings it back around to the Tuesday, Thursday. I mean, some surgeries can't be planned, but in the planning, is that common?
Yeah, I think most of us...
In a perfect world.
Right. Most of us, for elective surgery, we'd rather not schedule anything for Friday because, during the week you see patients, you see patients in the hospital who need things done. So you want to leave Friday open for these sort of patients. But Monday through Thursday is usually when you try and book all your elective surgery. And again, leave Friday open for anything that's left over and anything that comes through the emergency room that you got to get done. Because you don't want patients to just sit around over the weekend, and wait for, the following week. If you don't need to be in a hospital, you shouldn't be in a hospital.
Yeah, that's another thing I learned doing this program. The goal is to get you out of the hospital. It's not like the doctors want to keep you in there. I mean, you want to get out and get back to quality of life.
Individuals shouldn't be there if they don't need to, because hospitals, they're not... Bad things can happen, but so if you don't need to be there, don't be there.
Yeah, definitely. Well, it's a fascinating field, and we're always so happy to have you on the show. I didn't know if there's something, we got about another minute, something you wanted to share vascular surgery-wise. I asked you a lot about the future a little bit with robotic, but please, if there's anything you'd like to share. If not, I want to give out your info. And I found, you'll have to correct me if I'm wrong too, I found this list, and I searched, and you have a website with all these conditions you treat, and it's like A to W.
Yeah, those are conditions that really any well-trained vascular surgeon would treat. I mean, those are not unusual cases.
Yeah, and we didn't get to talk a little bit about limb salvage and as well, but I'd love to have you back on the program in the future. I know you're very gracious with your time. I think I've asked you on this show 3 times, once for me and 2 times for another radio host, and you've never turned us down. And local resident, too. You moved here from Baltimore, but you're Boca Raton resident?
We live in Lighthouse Point now, yeah.
Not too far.
Not too far from Boca.
Nice. Nice as well. Well, let me give out your info one more time, and if there's anything else we can add, it's Dr. Moji Gashti, Gashti. You can get there's a bio of him on westbocamedcenter.com. So that's West Boca and then medctr.com. You can find some information there. He's right in front of the West Boca Medical Center. His office is at 9980. We call it the 9980 building, and there's a few different buildings there. So 9980 Central Park Boulevard, Suite 314 in Boca Raton, and also at 3467 West Hillsborough Boulevard, Suite B. That's in Deerfield Beach, 561-483-3989. Dr. Gashti, thank you so much for coming to the You and Your Doctor show.
Well, thank you, David. It was a pleasure to be here again.
And we'll be right back. We're going to talk on the second half of the show about podiatry on the You and Your Doctor show.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. Hello, South Florida and beyond, and welcome back to the You and Your Doctor show, living a longer and healthier life. Second half of the program, as promised, we're going to talk podiatry, and I have here on the program Dr. Elizabeth Davis. She's a podiatrist, a DPM, Doctor of Podiatry Medicine at LA Podiatry Group in West Palm Beach and Wellington, I believe. Boy, it's been a while since we had a podiatrist on the program, so I'm really excited this portion of the program. Dr. Davis, how are you doing this evening?
I'm doing well. Thank you for having me.
Yeah, and thank you for joining us. I always call it a health adventure because we always learn so many new things and bringing the latest and greatest of the health to South Florida. So I haven't met you, so I wanted to ask you a little bit about your background to start out, educational background. I know you did a 3-year foot and ankle surgical residency, so that's a very prestigious residency there. So tell us a little bit about your educational background.
So I am a northerner, so I actually did my podiatry school in Cleveland, Ohio. It's now Kent State. And then after living in Cleveland for 4 years, everyone wants to move to Florida. So I came and did my surgical training at Memorial in Hollywood, Florida. So what a lot of people don't know about podiatry is I get the comment of, I didn't know you do surgery. You know, before you didn't have to do a surgical residency, and some people only did a 1 year. So several years ago, to kind of create uniformity, now everyone coming out should complete the 3-year training and be able to have a similar scope of practice. So I did complete the 3-year training, which allows me to do bone and soft tissue surgery from the leg down, so we can do even tibia and fibula work, as well as soft tissue even of the thigh. But after that, I went to practice, for the most part, always in Florida. So.
Oh, nice. That's a great background. Now, I saw on the website, and I'm going to give it out a few times, lapodiatrygroup.com. It's Dr. Elizabeth, and then they have Lizzie Davis. So they have it there in parentheses. So I just want to make sure that we get that out to the listeners as well. You're a native of Steubenville, Ohio. Is that correct?
Yes. Me and Dean Martin.
Nice. And got a little sick of those Cleveland winters, so now down here in Florida, I imagine. I wouldn't know because I'm originally from Jupiter, so someday, though, I'll get to maybe make a trip up there and check out those winters. But now, LA Podiatry, did I get that correctly on the beginning there, West Palm Beach and Wellington?
Mm-hmm, correct.
And you're on staff at which hospitals?
I am on staff at Wellington Regional, Palms West, St. Mary's, JFK North, JFK Main, and then some of the affiliated surgery centers. Wow.
Okay, so that's a very busy hospital load as well. Now, I wanted to ask you as well. Now, I saw that you're a certified wound care associate. Now, what exactly is that? I don't know if I've came across that. I'd love to bring that to the listeners and viewers of what kind of associate that is.
So, podiatry, one of the nice benefits of it is there's so many different things you can do. There's so many niches to it. I personally have always loved wound care. I feel I enjoy it. I love the relationships with the patients. So it's always been take up in a large portion of my practice. So there's a few different board certifications you can select to participate in if you'd like to, specific for wounds. I did mine through the American Board of Wound Management. You just had to be practicing within 3 years of actual wound care experience, whether you're an MD, a DO, or a podiatrist. And the whole process was, they just had some criteria based on experience and exposure. And I happened to meet all of that criteria. And I thought, what a better way to make myself stand out and appeal to my patients, especially because I work in a wound care center.
Now, are wound cares or wounds that fall under this category normally caused by diabetes, or correct me if I'm wrong, I think I've heard the term diabetic foot?
Yes, that's a big portion of it, especially what I see. But there's so many other causes. We treat anything from traumatic wounds, wounds after surgery, if there's healing complications, whether it's from trauma or just other health issues that would cause non-healing, wounds related to swelling in the legs. Not me specifically, but my wound care center has other specialists, and they treat anything from pressure wounds from people who are bedridden to when people have maybe a mastectomy and the flap fails, or burns from radiation from cancer treatment. There's so many different causes and etiologies. The wound care center itself can treat all of those. Me specifically, I do see a large population of the diabetic wounds.
Okay, and thanks for that point, that because I didn't think of that, traumatic wounds as well. Here in South Florida, a lot of people are out and about all times during the week, especially the weekend, like the term weekend warrior. I know it's not the greatest term, but people, can get those type of foot injuries. So I didn't put two and two together, so I'm glad you explained that as well. And you're on staff at a trauma center as well. And we're here with Dr. Elizabeth Davis. She is with the LA Podiatry Group and a whole bunch of hospitals in there. I know Wellington Regional Medical Center is one of them. I'll ask the doctor before we leave to tell us a little bit about the rest. Now, I was doing a little reading on you as well, and I saw something about innovative foot treatments that you offer. And we've talked a little bit about stem cells in this program, but never about in podiatry. I didn't know that existed. So is that something, that an innovative foot treatment that you're able to offer is with stem cells?
Yeah, so I just recently did a training over the weekend, myself and another colleague in my group, through the Global Stem Cell Group. And it was just a specialized training on harvesting and processing the stem cells, both from adipose or your fat tissue, as also from your marrow. And there's actually, podiatry is probably one of the most, they have so many opportunities to actually use the stem cells. One, you can use them in wound healing, in any type of joint or arthritis, chronic inflammation, just so many different things, especially any type of, whether it's a wear and tear arthritis, and then a lot of the other systemic degenerative illnesses from, there's studies going on with Parkinson's and MS that they were talking about. The problem with stem cells, though, is, it's not really recognized by the FDA, and there's not a lot of, most of them are patient-funded and private studies, and it is a cash-pay service. But for me, there's just a certain demographic of patients that they're not a surgical candidate. They don't want surgery. They don't have that opportunity or the lifestyle that allows them to have the downtime to be off their feet, and they're willing to try alternative treatments that may not have a ton of evidence in order to at least have the opportunity to heal.
I see. Now, where are those stem cells harvested from? Is it the actual individual's body, or how does that work?
Yeah, so that's one of the nice things about it. You don't have to worry about rejection because they're coming from your fat tissue. And when they're harvested from your fat, you also get some platelet-rich plasma, too, which people hear about all the time. And then from your actual, you can take it from your marrow.
Okay. Yeah, we've heard PRP a few times on this show, platelet-rich plasma injections. Now, yeah, and you made a great point there. It's actually taken from the individual's body, so no rejection. So that's great news as well. Is that something that can be done, that stem cell therapy, that's something that can be done right in the office, or does it have to be done at a surgery center or a hospital?
So there's a lot of equipment involved in harvesting and processing, and there's some time depending whether they come from the adipose or from the marrow. So there are certain facilities set up. We don't do them specifically in our office, but there's a local outpatient facility that has the equipment that's capable of it.
Okay, and then the people can actually, they can walk right out of there same day and go back to their quality of life in some terms, or not?
So as I am a firm believer of evidence-based medicine, which is ironic because there's not a lot of evidence in stem cells, but the day we did our training, we didn't have enough test subjects. We had some volunteer test subjects, and I actually let them harvest mine and inject it into my foot because I have a horrible turf toe from soccer that I've never been able to have time to get fixed. And I would say I had relief within 2 weeks.
Oh, that's great. You actually had it done yourself. Wow, you can't get a better testimonial than the doctor actually having it done herself. That's fantastic. Thanks for sharing that. That's a great testimonial. We're here with Dr. Elizabeth Davis, and we're talking podiatry. We have a few more questions. We're going to take a quick break, and on the other side, I'm going to ask Dr. Davis a little bit about peds versus adults and the advanced wound care products available, hyperbaric oxygen therapy as well, on the You and Your Doctor show. Living a longer and healthier life.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Health Care.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back on the You and Your Doctor show with Dr. Elizabeth Davis, a podiatrist at LA Podiatry Group and Wellington Regional Medical Center, as well as some other hospitals in the area. Dr. Davis, before the break, I talked a little bit about peds and adults. I kind of just tease it there. Now, as a podiatrist, do you also treat pediatric age patients as well?
We do, both in the office and surgically. I do tend to see more, in the office. A lot of patients would come in, and just common things we treat them for is we get a lot of ingrown toenails. A lot of parents concerned for maybe if they're walking in-toed or on their toes, or a lot of people come in and say they say they're walking on the side of their foot, but really they have flat feet, and we're either prescribing or making them orthotics and kind of educating patients on some strengthening and therapy type things to help them develop and support them as they grow to prevent further progression of it. And occasionally, sadly, we do get some of the ER patients too with injuries. But we get to see a little bit of everything.
Yeah, quick story. My first doctor visit outside of primary care was when I was 12. I was actually 6'1" at 12 and played a ton of basketball. I actually played too much basketball. I dunked a tennis ball when I was 12. And what had happened is I had, and doctor, you'll be able to elaborate a little bit on this. I had hurt my sesamoids, and I actually had to visit a podiatrist to have them kind of, I don't know if cut back is the word, kind of shaved down a little bit because they were causing a problem. Sesamoids, I believe, are kind of what you use to jump. Is that correct, Dr. Davis?
So they're
a little bit.
Little bones that sit under, I wouldn't say jump, but there are two little bones that sit under your, essentially near the big toe joint, and your main tendon that you push off with runs in between them. But it just so happens when people do jumping sports or maybe would fall from a height, they would be one of the first things that would impact the ground. Or if you do a lot of pushing off, they would definitely absorb most of that stress. So we do see, injuries to them or inflammation in them with repetitive jumping type sports.
Okay, I was a little off there, but thank you for steering me back on course. Now, I know that I'm referencing Wellington Regional Medical Center a lot here, and I know that they have an advanced wound care program. Can you tell us a little bit about the products and services provided at Wellington Regional's Wound Care Center?
Yeah, of course. So I'm a little biased because I work there, and I think we're amazing. And we've literally just recently received a Center of Distinction for the second year through Healogics, which is a company that kind of puts in place the algorithm we follow. But in general, for those of you who don't know, a wound care center is a specialized facility that we typically say when you either have a new wound that maybe is above a normal care provider, or if you have a wound that isn't healing at an appropriate rate, which is typically half the size in about 4 weeks, we have some other modalities and input that maybe we can offer that will get you healing in a more efficient fashion. And it's a multidisciplinary approach. We have multiple podiatrists, we have a plastic surgeon, we have general surgeons, we have an interventional radiologist and vascular surgeons we work with, infectious disease, we have orthotists that help with bracing and custom shoes. We have board-certified registered nurses. We have hyperbarics, just so many awesome educated team approach people with, we have a systematic algorithm we follow, and the goal is efficient care that gets you healed quicker, as opposed to people who have wounds, in a time where we're really concerned about the cost of healthcare. It's a more efficient way to heal as opposed to dragging it out. And the quicker you heal, the less risk it is to you as a whole and less impact on your life.
And then this goes into hyperbaric oxygen therapy treatment as well. And if so, who is a candidate for that kind of treatment? I've learned a little bit about that recently, but I still don't know too much. So if you could explain a little bit about the hyperbaric oxygen therapy.
Yeah, so a hyperbaric facility, they're not at every wound care center, and we're fortunate to have several mono chambers, which means you're in the actual device by yourself. Some other locations may have a multi-person chamber, but ours are individual. And I tell people to kind of think of an acrylic clear tanning bed. And what it is it's a device that you're breathing in 100% oxygen under pressure. So in layman's terms, in a normal person, your blood cells are taking around the oxygen. But when you're in a hyperbaric chamber, it's putting the oxygen in pretty much all of the fluid in your body. So we may have a patient who had a traumatic injury or a burn or may not have the circulation to an area that a wound is, and there wouldn't be a way to get that oxygen there to heal. So this is a way to get it there. It helps kill bacteria. It helps grow new blood vessels. There's so many different diagnoses that warrant hyperbarics, and a lot of people don't even know them. The most common thing that people talk about is the bends, obviously with scuba divers that resurface too quickly. For us, diabetic wounds with bone infections, people with peripheral vascular disease that maybe have been surgically corrected as much as possible, but they may not have the flow to where they need or where their wound location is, or they may not even be a surgical candidate. We use it for radiation burns, carbon monoxide poisoning, trauma, where the tissue has died. They've used it in strokes. There's so many different options.
And that's something, if someone was to see you, you're able to, obviously, as a podiatrist, doctor of podiatry medicine, able to refer to this hyperbaric oxygen therapy treatment, the wound care center?
Yeah, so pretty much any podiatrist and any other medical professional for that matter can typically spot a wound or a condition that may require we call them advanced healing modalities, and they would refer you to a wound care center. Now, when you come to the wound care center, we're definitely on the lookout for patients who meet that criteria or may have a diagnosis or would benefit from it. And then there's specific providers, a podiatrist not specifically, I can't oversee hyperbarics, but there's a few other specialists that assess you. You know, there's we still have to check your heart, your ears. There's certain medical conditions that may exclude you from it, but there's a full workup, including labs and examination. And if you meet the diagnosis criteria and you're appropriate health-wise and illness-wise, then, we get together and create a DISE protocol for you. And there's a monitoring assessment where we look at your oxygen just to make sure it's beneficial and actually working.
We're here with Dr. Elizabeth Davis. She's a podiatrist, 561-433-5577. Dr. Davis, I just have about 2 minutes left. I want to ask you about foot deformities. What are some of the treatment options available?
So depending, again, whether they're congenital, you're born with them, or it's just wear and tear from functioning with high arches or low arches, or most of us women who shove our feet in beautiful shoes that we shouldn't be doing. Treatment ranges from, obviously, padding and changing in shoe gears, orthotics, which a lot of people aren't familiar with, that can be purchased over the counter or custom molded specifically for you that allow you to function more neutrally and prevent all the compensations and problems that come with abnormal functioning. And also,
you can go ahead. We have less than a minute. Go ahead.
Yeah, so that's the main thing we can do, but there's a lot of different padding options, and a lot of them require your physical examinations, and we can make more personalized recommendations.
Well, thank you so much, Dr. Davis, for bringing us the latest and greatest in podiatry. I'd really like to have you back on the program if you'd like, definitely.
Well, thank you for having me.
And Dr. Davis, find her at 2326 South Congress Avenue, Suite 1A, West Palm Beach, or 3347 State Road 7, Suite 204 in Wellington, lapodiatrygroup.com. And like I said, she's on staff at Wellington Regional Medical Center and other hospitals. Thank you, South Florida.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
$5 p.m. Talk 1470 is WWNN Pompano Beach and 95.3 FM W237BD Boca Raton, the Health and Wealth Radio Network.
What is the Del Walmsley Radio Show?
Welcome to the Del Walmsley Radio Show, where the hype ends and the health begins. I'm your host, Del Walmsley, and as always, we're working on your financial freedom.
Listen to the Del Walmsley Radio Show, Mondays at 5, Tuesday through Friday at noon on WNN.
Go to your app store and download the WNN app on your Android or iPhone. And never miss a Talk 1470 minute.
Yo, Yo, what's up? It's Coach Nick from Nick Cavallo Marketing. If you need any kind of digital marketing or you just want to talk to Coach Nick, reach out to me at 516-666-2345, or you can visit us on the web at www.nickcavallo.com. That's NICKCAVALLO.com. I'm Coach Nick, and I'm out of here. Peace!
Welcome to the SoFlo Business Corner. My name is Tom Hibbert. I want to welcome all business owners to come onto the show and share and grow their business. So let's get on with the show.
Welcome. My name's Tom Hibbert, and this is Tell Us Your Biz. I'm here to talk about business, but we have a special edition of Tell Us Your Biz. This is called the Wedding Talk special edition that we have here. This is a show that I ran with a friend of mine, Steve O'Flaherty. I'm going to introduce him in a second. And what we're doing is just creating a forum for brides and wedding vendors to talk about their business, to talk about their weddings, and have an opportunity to learn a little bit about the business, so that it gave them a little information. I'm sitting here with my good friend Steve O'Flaherty.
Tommy,
how you doing,
what's
buddy?
happening, Tommy? What's going on?
I love every minute talking with you, buddy.
No, all the time, all the time. I'm so glad to be back. I was excited. Finally, Wedding Talk is back. People were disappointed. We were doing this just about a year ago.
Yep.
We had great success, and then we were shooting it in my living room.
Real quick before you start explaining all that, what was your vision when creating that?
So, of course, owner and operator of New York Sounds.
Absolutely.
I'm in the wedding industry 27 years. So, especially being on social media now, you see so many different forums where brides are begging for help. They're begging. They have so many questions, and they have different resources they go to, and they don't have that one-on-one touch and feel of someone that is taking care of them. So take my expertise and bring all the professionals that I know to the show, and give them an opportunity to get all their questions answered.
Well, listen, that in general is so important. I mean, as you know, I'm getting married in October. I love you, baby.
Wow.
Yes.
Who would have thought?
After 7 years, it's amazing. So when she's going around sometimes, and luckily we have you as a friend and some other people in the business as friends, she doesn't know what to do. She doesn't know where to go, or she feels like she's missing out on something. And I feel when we were creating the original Wedding Talk in your living room, it was a great place for women, so that they got that peace of mind to know more about that show and know more about the weddings and what's involved. So I thought that was very powerful.
Well, two biggest challenges today for our brides is, number one, like you just said, you don't get married every day. So you don't know what to do, where to go, and how to find out. So that's number one. And number two, the biggest challenge they have is time. So most of our brides are sitting at an office from 9 to 5, 9 to 6. Thank God for social media and their cell phones. When they should be working, they're on their cell phones. But why not put in a show or put in a forum where, hey, if they're at their desk, they can text or type over a question and we can get it answered. So every segment that I'm going to be putting onto this show every Thursday is going to have a different guest. Today I have an exciting guest. I have Mike Plow from Empire Photo Booth Rentals. He has the new mirror photo booth. I'm sure you've seen it.
Oh, it's fantastic. It's
it's the new thing on the market, and we're going to let him talk more about that. But like I said, when we stopped doing it, and we got to a point where we were actually traveling to different venues. Remember, we went to the Holiday Inn, and we saw Jackie Schwank. So we were going different places, but I guess between time crunches and everything else, it got a little crazy.
You're a busy guy. I had a lot going on at that time, too. So and connecting the three dots, connecting you, me, and the vendors sometimes just didn't work the way we wanted it to. But what you said was a good thing that I want to plug real quick. If you do have a question for Steve O'Flaherty and soon coming up Empire Photo Booth, you can give us a call at 1-888-565-1470. That's 1-888-565-1470.
Yeah, call in. And you know what? If you don't call in, ladies and gentlemen, sometimes the groom's very rare. Do I speak to the grooms? But If you got questions like Tommy just said, call in, and if you don't call in, inbox me, and we'll address it on the next show. And that's what we were doing last time.
Absolutely.
You know, and I want to say thank you and a big shout out to Freddie and Dawn because of the Brooklyn Cafe and all they do.
Well, the Brooklyn Cafe is absolutely amazing, and then Freddie, of course, is Freddie Santori is our producer of the show, which is amazing producer. Amazing producer.
Well, don't say it too loud because he hears that and his head gets all crazy. But no, it's a great guy.
So, so you mentioned that you were in the business for 28 years. What
7? Don't make me older.
What have you learned in those 27 years?
Well, I mean, what I've actually watched and still learning is how the industry has gone in different directions. You know, challenges from back in the day still exist as far as competition. You know, the market is drenched with DJs. I mean, there's DJs on every corner. So that's always been a challenge. But, you know, even the flow of events of weddings, you know, a lot of the formalities are leaving. You know, I mean, little by little, they're not doing even the bouquet and garter anymore. But then you got, you know, the people who stick to tradition. So, you know, it's a little...
How is it managing with those brides? Is it a difficult process? Is it...
Well, at the end of the day, I always tell my brides this when I sit down with them. This is your day. I work for you. I will always give you my professional advice. But at the end of the day, they make the final decision. This way, if and when it doesn't work, they can't point the finger at me. But I'm not the guy that says, I told you so. At the end of the day, if they walk away happy,
you pretty much do everything. They're giving you a vision, and you're pretty much bringing it to life.
I'm the artist. You know, what I do is an art, and you know, and you know, and that's a big challenge, Tom, because you know, I don't think people really appreciate of the art that we do, and there's different kinds of DJs. You know, I mean, you sit there and you look at let's say a club DJ. He's great mixing and he gets the crowd pumping and everything else, but does he MC and do the formalities that we do? You know, does he take that time for the personal touch? And if someone doesn't do weddings quite often, then, you know, you're going to lose that factor. It's really important to keep your crowd engaged, MCing, and, you know, and the crowd feels involved and part of it. Even the people who don't dance, you want them to leave going, wow, you know, that was a show. You know, that was something to remember. So,
what are some of the things that you're finding as a DJ, and what is the number one thing that you'd see is like the most difficult situation that a bride is facing, at least at your end? Is there any trials that a bride comes up that faces that is easily overcome if they did one thing or another, maybe prepared a little differently?
Well, up and down is budget. You know, it comes down to finance, and who's willing to work with them, who's willing to sit there and bend the numbers a little bit, and who's sticking to what their expectation is as far as pricing. I'm a big believer in working with our clients, but I'm also a big believer in trying to get at what we're worth. You know, at the end of the day, in this, you only get one chance to do it right.
Absolutely.
You know what I'm saying? So, as brides out there, do you want to walk away and say, I coulda, shoulda, woulda? You know? At the end of the day, if you like what you see, read our reviews. I give plenty of videos and demos and stuff. I'm constantly putting up stuff. You can go to The Knot, you go to Wedding Wire, you go to my Facebook, read all about me, read all about my staff. And at the end of the day, if I'm giving you a fair deal, I'm confident in not only the quality of work that I do, but I'm confident in my pricing as well. And, you know, there's people in the business that kill that because, you know, they'll go out for a couple $100 and, you know, it hurts the industry.
Okay.
So,
with Wedding Talk, and obviously you are such an expert with this, you have a lot of context being in the business. Where do you want to see this Wedding Talk show go from here now that we have the platform that we do? And what do you want to see out of this Wedding Talk show, and what do you want to provide to our listeners?
Wedding Talk is going to help my brides and my potential brides not only to get to know me, but to get to know the people I bring to the table. When I sit down with my brides at every, my first initial meetings, I profile them. Hey, what are you missing? What do you need? I don't come to the table just going, hey, look, I'm your DJ. No, I'm your DJ. I'm your lighting. I'm your photographer, videographer, flowers, and everything. Brides are looking for simplicity. If they can get away with calling only one vendor and getting everything done versus calling 9 or 10, it's a win-win.
Okay.
So my whole goal here is, like I said, for you to get to know me, but to get to know the team that I'm actually referring out.
And you have an extensive team. I mean, you've done work with what's that guy from Say Yes to the Dress? You did his bridal show.
Oh, Randy Finelli.
Randy Finelli.
I do it every once a year. Randy, if you're watching, that's a big thing. Brides love seeing Randy on our Facebook. You were at the event with me.
Oh yeah, it was a great time.
And Randy, you know what? I mean, as big as he is, he was a down to earth guy, right? I honestly was expecting him to be kind of stiff and in the back, but nope, he was right in the show. He was in our booth. I mean, it was kind of cool. Yeah, I've done some big events. I've done some red carpets. So So in
other words, you pretty much you've literally worked from as high as you can go all the way down to.
If you go back to the beginning, Tommy, I started when my dad's friend my dad's friend's son-in-law had a business in New York, and he was looking for someone to just help lugging the equipment. So I started just carrying equipment, and saw the DJ part of it, got interested. I learned that. A couple of years went by. I learned MC. I mean, so I started from where I was actually DJing with cassettes and vinyl, to CDs, to now digital. I mean, so like I said in the beginning, I've watched this industry evolve into so many different ways that I could appreciate where I was, where I am now, and where I'm looking forward to be.
No, and that's really the most important part. Why don't you go ahead and let us know who's coming up next? Who you have?
So coming up next, he has the newest, biggest, baddest thing going on right now in the wedding industry.
What is that?
He has the Mirror Me photo booth, where it's a mirror, and you know what? I can't even begin to tell you, Tom, what it does, because it does almost anything. I mean, you can get celebrities on the mirror, talking to them. You can actually, brides, this is a big key. I put up videos of this mirror constantly on my Facebook and on my website. But one video I don't have, and I promise we're going to get it. This mirror, actually, you can do your table settings. So when your guests walk in, they go to the mirror. All the tables are there. They click on the table, and it tells you who's sitting where. That's huge. So we're going from back in the day where there was little index cards in the front table. Remember when you used to go to weddings? Now you go into a mirror, you're pressing a button, and boom, there it is. He has top-of-the-line props.
Well, don't take away all his talking.
No. Well, I get excited. I get too excited. So his name is Michael Pla, originally from New York. It's not in New York. I'm not trying to stick to a New York thing. It just happens to be, we know what we're doing up there. But anyway, so that's who I'm bringing on.
All right, perfect. Well, we're gonna take a break real quick, and when we come back, we're gonna have Michael Pla with Empire Photo Booth, and we'll see you guys in a minute.
Yo, what's up? It's Coach Nick from Nick Cavallo Marketing. If you need any kind of digital marketing or you just want to talk to Coach Nick, reach out to me at 516-666-2345, or you can visit us on the web at www.nickcavallo.com. That's NickCavallo.com. I'm Coach Nick, and I'm out of here. Peace!
Welcome back to the SoFlo Business Corner. If you want to join the show, call 1-888-565-1470. We want to hear from you. Once again, that number is 1-888-565-1470. Now let's get back to the show.
Welcome back. My name is Tom Hibbert, and this is Tell Us Your Biz. We have a special edition called Wedding Talk. We're bringing back Wedding Talk Live. We have Michael Pla here with Empire Photo Booth, and my main man, Steve O'Flaherty. Let me just make sure that this gets set up for you guys.
Make sure you get my good side.
Yeah. Well, if you had a good side, I would. So, Michael, you're here, and Steve, why don't you go ahead and let us introduce Michael so we can get a little bit of
Mr.
info.
Michael Pla. Should I put my DJ voice on?
There you go.
Michael Pla. Coincidentally, he's my brother-in-law. He married my baby sister.
Surprise, surprise.
So we go back. We're actually family. But recently, he just invested into the photo mirror. And Mike, I'd rather you go in to tell me what it does, because it's way too much for me to remember.
Absolutely. Well, Tom, first of all, happy to be here.
Thank you.
What I did was I was helping Steve out and just happened to come across this mirror, and we were at an expo. I kind of saw it in the corner and was like, whoa, what is that? And was helping him out with a lot of his gigs and stuff. Before this was a DJ, of course, in New York, go figure. And the photo booth side of it, when I saw the mirror, I said, we have to, we have to get it. As he said earlier.
What about it though made you say, I have to have that. I have to be a part of that.
You know what? I think it was the line that was in front of the mirror. I mean, these women were literally lined up around the corner, ready to take pictures in front of it, because it's basically you standing in front of the mirror, and the mirror is taking a picture of you. You don't even have to use your phone to take a selfie.
Okay, so it was such a piece that everybody had to be a part of it.
Everybody had to be a part of it.
What makes it that piece?
I mean, first of all, we just actually spoke about this last night. Basically, how they were looking at it was, it was easy for them. It's a touchscreen. It has animations on it, voice guidance. It has a countdown on it. Okay. And it has a LED ring around where the actual camera lens is, so you're looking directly at that. It's self-explanatory as soon as you step up to it.
Emojis.
So it makes
stamp it emojis. It's amazing.
So it's pretty much, and excuse the wording, but it's pretty much idiot-proof. Is that right? Is that?
I mean, not really.
Okay.
Not really. I mean,
nowadays,
you do need.
No such thing.
Well, you guys are living proof of that sometimes.
Real nice. No, you actually need, you need somebody there to assist them with it, because it has. I mean, it's not idiot proof, but at the same time, once the picture is taken, then everybody's like, oh well, what do I do now? And then the next screen comes on, and then it'll ask them, how many copies do you want?
Okay, so it like walks you through step by step. There's somebody there always manning it to make sure that they know what's going on. That's you.
Always.
Okay, so you're kind of like the guide to this.
I am the guy. Look, most of the Mirror Me booth owners, they have personality, and they want to have fun. It's an entertaining thing. And, that's what I wanted to do. The second I saw it and I saw the guy that was working it, I was like, you know what? We need to be doing this. And that's why I invested in it. And, it's fun.
No, that's fantastic. What have you found with this mirror that people like the most about it? Like, what is the driving force when people book this wedding, this mirror?
I mean, it's actually classy. When you look at it, it's a giant 5-foot by 3 mirror.
Okay.
And it's almost like, when, I've been into, plenty of, big houses before, and you have these giant mirrors on the wall. Now you have one sitting right on the floor there, staring at you with a camera behind it, taking your picture. I mean, that's what it's about.
So in other words, what you're saying is like, because I mean, I've been to weddings before, and they have big booths, or they take up a lot of room.
Yeah.
You're not this mirror is taking up very little room. Is that right?
Very little room. Very little room.
Okay.
What we have set up is a red carpet with the brass stanchions with the velvet rope. Walk right up to it. It's very simple. Fits right into a corner. I have the the props. Premium props, from a panda mask to the Batman mask, and all these, a lot of kids like it also.
Oh, of course.
But the adults, of course, they go crazy for it too. And once that's we have that set up, the printer's right there, right next to it. It's a very it's pretty small. Like, you don't have to have these, giant, sorry to say.
Oh, now he's gonna knock. I bring him on as a guest. He's knocking my roof. All right.
No, but it's a lot of brides, they'll look at it and say, hey, I definitely want that.
Okay.
The animations is what really puts it a step ahead of everybody else.
Okay.
It's a new level of fun.
Perfect.
Just to touch on that.
Yeah, please.
I think that at the end of the day, the bride, any bride, they don't want to be cookie cutting. They want something that no one's seen before.
Mm-hmm.
Right now, this is that product. This is that product where, we've all seen the photo booths with the little,
the curtain
covering.
The old school,
as he referenced,
the little
my
printing.
photo booth that's inflatable and LED. It's great.
Yeah.
It's real cool. But now it's aged a little bit.
Mm-hmm.
This is the new thing.
It's time to evolve.
So now it's the brides see that and they're like, you know what? I've never been to a wedding that has it. I have to have it in mine.
Mm.
So that's where we're at with the mirror. So that's what the exciting piece of it is.
Have you had this mirror booked at any of your weddings so far?
So far we booked 3.
3 of them, yeah.
We're only, he's only in business 2 or 3 months.
Oh wow, that's fantastic.
Just starting out. It's a brand new thing. But I'm business savvy. I'm definitely seasoned.
Mm-hmm.
But I know what the brides and the grooms are looking for.
Mm-hmm.
Working with Steve, I've been working with Steve for almost 14 years. Well, it's actually 14 years. And
Lucky
well, lucky you have
some
brother
people hit
like
the
me.
lotto and some people work with me. I think you both can say that. But anyway.
Actually, yeah. But I mean, knowing that, having that time with him, and seeing, go even just today, going, and meeting with a bride, or meeting with anybody that is having a special occasion, an event, or even a corporate event. The interaction between him and the client.
Mm-hmm.
Just knowing all of that and being able to start a business myself and saying, hey, I could do the same thing, especially when it comes to weddings. Weddings, are huge, especially we're in South Florida. This is a destination wedding.
Oh, yeah.
But I have the same
capital.
I don't think it's limited to wedding.
No.
I think it's
not
used
just
in key
yeah.
parties.
Correct.
Mm-hmm.
And I actually think it would be fun to do corporate events. We're actually going to go to your event next month, Tommy.
Okay.
May 14th, right?
May
At
14th.
Uzo Bay.
At Uzo Bay, yep.
Tommy runs a great show there. We have a lot of fun, but I think that we're actually going to bring the mirror out.
Perfect, yeah. That'd be a great thing to have.
We'll have the mirror there, and people can actually, people want to feel, they want to touch, they want to see what's going on. Next week, we're actually going to Out of the Blue over in Jupiter.
Okay.
We're actually bringing the mirror there, and we're actually going to, because like I said to you earlier before that we started with Mike, it's so much. It's so much that it does.
So many things
So
that it does.
we're going to actually shoot a demo, an informative demo of each step, everything that it does. We're going to try and make the video as short as possible, but at least when we sit down with a bride, she can watch this 4 or 6 minute clip of, okay, look, this is what it does, and this is how it works. So now it's more,
Well, have I seen videos on this before?
You've seen plenty of demos.
I've seen stuff
You've
before,
seen demos
right?
of it being used at a wedding.
But it's not a step by step.
No.
Like I
Step by
said,
step.
all the demos we have out, there's not one demo right now that shows the table seating.
Okay.
To me, that's a big seller.
Yeah.
Catering managers, I've mentioned it to Beth over at Delaware, they love that. Because like I said, we're getting rid of the cards on the table. And now here you are. You go up to the mirror, table 4. Oh, I'm sitting there. Oh, and I think it's real cool.
It's nice.
It's different.
It's a workflow that we put together before any event. So when we're in contact with the bride and the groom, they can give us a whole entire list, and I'll put it together for them.
Perfect. Now, with this video that's coming out and the videos that are already out, when is that demo? You said you guys are shooting it next week. When do you expect to have it out?
Next week, and we're going to edit it. I would say give us another 10 days.
Okay.
To get it edited and get it finalized. So.
Well, listen. Let's make sure everybody knows where to go to find those demos. So. Where can we find what you have so far and what to expect in about 10 days?
I've actually put a few of them already on our Facebook page, which is Empire Photo Booth Rentals. And I also have a couple of them on our website as well. It's www.empirephotoboothrentals.com.
And if you check out the Wedding Talk Facebook page, just facebook.com/Wedding Talk, you can actually see all that linked up. You see the video that we have set up there. And his website is also posted at the bottom of the video because we record all these videos and make sure that they're posted and shared everywhere else. So if you guys are driving in the car or somehow forget, you can go back to facebook.com/Wedding Talk and you guys can see it right there.
Wedding Talk is back.
It is back. How does that feel, buddy? How does that feel, buddy?
I'm excited. I've been waiting for this. This is my
I'm excited
my
for
Dr. Phil moment. You know, I mean, this is my this is my time to shine. But because I'm not only helping myself, I'm not only helping the brides, I'm helping my fellow, my
your
vendors,
peers,
my
your vendors,
peers.
your
And that's what I'm all about. I'm all about helping. You know, I'm a big fan of karma. You know, what you put in is what you get back, and you know.
Okay. And Mike, how does it feel to be on the first revamped episode of
I
the
love
first
it.
episode?
I love it. The first, for the revamp. Yeah, no, I love it. I love it. I'm happy to be here. Happy to be able to promote my business as well. You know, that's a big plus for me.
Perfect. Well, we're going to be back here again. My name is Tom Hibbert. This is Tell Us Your Biz special edition with Wedding Talk. Go ahead and check us out. You can check us out on facebook.com/Wedding Talk, facebook.com/Wedding Talk, and I hope to hear from you guys next week.
Tommy, thanks for having us. Again, another shout out, Freddie and Dawn, Brooklyn Cafe, be there. And we'll see you soon.
All right, we're good to go.
My name's Tom Hibbert. I want to thank you for joining the show today. Make sure to join us next week where we're going to help you share and grow your business.